At Kheth'Impilo, we are focused on supporting the Department of Health and doing it with as much as possible innovation, looking at gaps in the healthcare and thinking of new methods, new ways to fill that gap, to do the work we've been doing, to look at have we been doing it right, or do we need to, in an innovative way, do something different that can really make a difference in the healthcare system. So the clinics in South Africa, traditionally you got primary healthcare facilities with no pharmacy staff there full-time, which means that the nurses who have to treat the patients, they have to spend their time caring and treating and consulting the patients. You're also expecting them to manage the medication and manage the stock and making sure that there's enough medicine supply, making sure that the orders go in on time. So that is a big challenge that the facilities face. There's this huge number of patients standing in front of the doors, queuing, and the staff just get tired and too busy. We have to date trained more than 266 learners who are now qualified pharmacist assistants. More than 95% of them are employed by the Department of Health.
Okay, so what are our various barriers to communication? Case in point?
Noise.
Noise. What kind of noise?
The pharmacist assistant training program focuses on 3 key features. Firstly, the transformation from unemployment to employment. Secondly, an innovative way in actually mentoring and training these learners. And thirdly, the evidence-based outcomes. When you have a pharmacist assistant full-time in the facility, that person takes an enormous amount of work from the nurses.
Under my supervision, we can use the learner basics a lot.
Can you see what's in there? Yeah. And spray.
From the day they set foot in the pharmacy, they can actually start to help. If they can read and they know the alphabet, then the basic assistants start off running and they never stop again. With our patient waiting times, it's less than 20 minutes, and that's all because of the assistants' help.
As they become economically active, they mobilize more than 39 million rand back into these marginalized communities on an annual basis, just in salaries. Don't look at the challenges and think we're never going to get there, or think that it's never going to change, because it will change. If there's enough people in South Africa believing that it will change, it will change.